I'm delighted to open the first session, which is looking at parks as health infrastructure, why, what and how, with a highlight on Camden and Islington, chaired by Dave Bell, who's the Principal Advisor for Health, Wellbeing and the Environment from Natural England. This is one of our Future Parks partnerships where the journey of transformation has been focused very much on health. I'm going to hand over to our chair for this session, as Dave Bell, and over to you, Dave. I hope you're with us. Great.
Hi, Isabel. Thanks, and hi, everybody. It's great to see over 200 people on the call this morning. So I hope the sun's shining wherever you are. I'm here in just outside Manchester, between Manchester and the Peak Districts, in my attic, and I've had to close the windows so that I don't have too much sun on my face today. As Isabel said, yeah, I'm Dave Bell. I'm Principal Advisor in Natural England for Health and the Environment. But this morning, the next half hour is really to hear from the work going on in Camden and Islington. So Parks for Health has been a collaborative approach by Camden and Islington, who have a shared public health team, but their own respective green space services. They work amazingly closely together, and they have been building really strong links between health and accessible green space right in the heart of London. So I'm delighted to introduce Oliver Jones, who's Head of Green Spaces in Camden, and Andrew Bedford, who's Head of Green Space and Leisure in Islington. So in the first half of the session, Andrew and Ollie will share how they've repositioned green spaces in both boroughs as health infrastructure. And then in the second part, I'll be asking some questions to them. Really want to take some of your questions. I'm sure you'll have a lot to ask them. And Ollie has assured me before the session that they've been working together so long that no question will faze them. So if you think you have a question that might faze them, please be my guest. So that's enough from me. I'm going to pass over to Ollie and Andrew now.
Morning, everybody, and it's really a real pleasure to be here talking to you this morning about our particular journey on the Future Parks Accelerator programme, which was the Camden and Islington Parks for Health programme. So I'm going to try and give we're going to try and give a little bit of a deep dive, a bit of a flavour of what we did over 3 years, but we're going to try and do that in 15-20 minutes. So obviously we can only give, scratch the surface a little bit of what we did. So next slide, please. So parks, our sort of original vision was to sort of, as talked about yesterday, parks were created by the Victorians as a direct response to the public health sort of crisis of the time. Overcrowding, deprivation, poverty, poor air quality. So we really wanted to think about that. And so parks for the modern day health crisis that we find ourselves in. Our sort of journey started back when I was really thinking about, as a council, we were looking at early intervention and prevention and how we wanted to really put a focus on that. Councils are facing huge pressures on budgets. Some of the biggest areas where those pressures lie are around, adult social care, children's services, and the growing demand on those services that are driving big budget pressures. So actually, as a council as a whole, we want to look at how did we really embed early intervention prevention into everything we did. And I spoke to my counterpart in Camden, who was having a very similar sort of thinking. And we said, well, what happens to a park service if you try and put health right at the heart of what you're doing? So we embarked on that journey, and lockdowns really sort of emphasised that, put parks front and centre of that debate around how parks can help with health and well-being. Obviously, during lockdown, nobody had anywhere else to go, so parks became, really at the forefront. But COVID has also exacerbated those health inequalities and really emphasised the role that parks can play in tackling that. But what we found are parks that are often used by those that are already reasonably active and healthy. Then they're passive providers of those health benefits. They're there, people come to them, that's great. But they're not proactive. So we wanted to change that to make parks active providers of health benefits and to really diversify the users so that those that would benefit most actually start to come into our parks and use them and are able to access them. Next slide, please. So why is it important? I mean, I think, you know, the video you've just seen earlier started to show that, but and you know, we're a really dense urban borough. I don't think Islington is quite the most dense now. I think Tower Hamlets has overtaken us. I don't think we got any better. I think they got slightly worse. Lots of residents without access to a garden, incredibly densely populated, and huge health inequalities. The life expectancy difference there you can see between some of the richest and poorest parts of the boroughs, really extreme, and high levels of mental health and high levels of social isolation and loneliness. And this, if you like, is a sort of modern health, public health crisis that we're facing. So what role can parks play in that? So next slide, please. We really had to think about how our parks met that need. Move to the next slide. So we developed a new vision, and this took sort of us 3 years. We thought we came with a very sort of strong focus on what we wanted to achieve, but actually, when we got into the nuts and bolts of it, it's turned out to be actually fairly complicated as to what that meant in practice. But we've created a shared Camden and Islington Parks for Health strategy. We'll put a link in there so you can see that. But those were our core vision around making sure that our parks and green spaces were used as public health assets for the whole community, that everybody benefited, that more people used them before to be healthy and happy, that our parks were places where people would come together to spend time, to pause and reflect, and that our parks are at the heart of community life. Next slide, please. So we embarked on a big co-design process, engaging not just groups that we already work with, and the Friends of groups, so they really have a really important role in understanding, you know, how they use parks and how we can build on their success, but also lots of other organisations that we hadn't talked to before. Some of the voluntary sector, the health and social care partners, organisations like AIDS UK, Voluntary Action Camden, but also GP practices, social prescribing organisations, the integrated care partnerships, health commissioners, to really embarked on a really detailed sort of engagement process to sort of think about what did that mean, what does a healthy park look like, and how do we break down some of the barriers of people accessing those. And we were doing lots of co-design work, and that photograph is I will always remember it because it was a green social prescribing workshop with lots of GPs and like social link workers, and then it was just the day before lockdown was announced, and I'm trying to deliver a public health project during a global health pandemic did prove to be quite a challenge in terms of then engaging people through that process. VCS organisations then got diverted into other things. But what we found was it changed the conversation, because when we started talking to people, health providers and the commissioners about parks and health, suddenly it was like a light bulb. It's like, yes, we're pushing an open door here, because people are starting to experience for themselves what that meant in practice and how beneficial parks could be. So I'm going to hand over to Ollie now. He's going to talk us through some of the hows of what we did to turn that vision into practice.
Good morning. So next slide, please, Owen. This is what was mentioned by Robin yesterday as part of the kind of economic kind of understanding of what parks are like. And one of the best things to do is to really understand what the kind of physical infrastructure and the social infrastructure of your spaces are, but also to have a kind of understanding of how they sit within the wider communities. So for those unsure exactly where Camden and Islington are, we go all the way down to Covent Garden and all the way up to Hampstead, the top of Hampstead Heath, west to Kilburn, and east all the way over to Finsbury Park and Andrew Host Arsenal Football Stadium, and nearly to Hackney. It's so it's quite a slither of London, and therefore we have very different kind of spaces. So understanding what's in them is quite important, because of the interaction of the parks and how they connect and how they are being used is imperative. The next slide, please. And then obviously, as part of that, we need to know what our communities are like. And we are lucky to have a very good shared public health team that worked very closely with us. They were at the third leg of our kind of stool as we kind of thought about it. They helped us get the data and understand the kind of how we connected with those communities. And we commissioned, because they were a bit busy during COVID, obviously, a consultant to kind of create that kind of health strategy. So through that health strategy, we undertake formal assessments of our parks to understand what infrastructure is there, and that was kind of connected to the kind of health impacts, the health needs of the local communities. So it gave us an idea of where the gaps were, where we needed to think about it differently, and that's not just the kind of physical infrastructures. It made us think about how we could fill those gaps with the kind of social infrastructure and the kind of social prescribing side of it. But, next slide, please. So we worked with an awful lot of partners across this, and Andrew kind of touched on it. Many of the ones you see here are what I'd call kind of like infrastructure partners from the VCS. So they were already embedded in the community, knew the communities, knew those who are in most need, but they hadn't really had a lot of interaction with us. And the kind of Parks for Health, even just the name, but also the kind of aspiration and vision that we had, brought them to the table. And for those of you who heard Piers talk yesterday, it's quite a seminal moment having these organisations in a room and us talking about, well, how can a park help you? And you could see the kind of penny drop for all of us. We really needed to start using parks more. This is one of the positive sides of COVID, because suddenly, as we were coming out of lockdown, everyone wanted to do things, but no one wanted to do them inside anymore. So, we were the kind of marriage of us being open to, we want to support people's health, we're here to kind of help. And then the VCS coming and saying, well, we need to use a park for, some chair yoga, or, we'd like to host a little festival to bring people together because they haven't seen each other for so long. Suddenly we were, yes. What do you need? How can we help you? And it kind of changed our initial response from away from thinking about, it's going to trample the grass and it's going to, make it look a bit messy, to, this is exactly what we want. We want people in our spaces to benefit from the kind of healthy impact of them. The academic research is there. It's just how we get people into the parks is, really our challenge, and how we get some of those communities that aren't there all of the time, and kind of changing their feel and understanding of the spaces. Next slide, please. One of the things we've been good at, and you've seen some of it in the videos, is kind of creating activities in our green spaces. And we are lucky as a Central London Borough that we do have a fair bit of infrastructure in our park. So outdoor gyms, lots of seating, lots of spaces, but they are small. They are very, very small kind of areas. So we are looking at how we can bring people into those spaces. So some examples here of kind of chair yoga and community gardening. So it really kind of brought people into a space and made it usable and kind of beneficial for them, and what their needs were. We also looked at how we can actually empower the community to feel comfortable in our spaces. So being very clear about what was allowed, because what we've discovered quite early on was people were automatically thinking that it wasn't allowed to do something in the park. So being clear about when they need to tell us if it's an event, or what kind of activities were, we didn't support, and also actively using our teams to go out and talk to great groups like the Bloomsbury Parks Association about green walks, and actually almost just helping what they're already doing. So they're already doing walking talks at parks, but suddenly we were there saying, okay, well, we can do all the posters, we can get them up for you, we can get it on our 30,000 Twitter handle. We can get people to know what you're doing, and just kind of amplify some of the activity that is already taking place. Next slide, please. And over to you, Andrew, I think.
Yeah, so we looked to really try and break down the barriers. Some of those activities we really had a focus on as green social prescribing as one of we developed as one of the key pathways to try and get people connected into activities that perhaps hadn't used those before. So we did a lot of work with social prescribing link worker organisations to sort of set out what were the sort of standards and expectations around if they were going to refer someone into a social prescribing activity or green social prescribing activity, what did that look like? So we actually worked to develop a charter. We tested and trialed some green social prescribing activities, what sort of worked, what people need when they arrive, what sort of skills do the people running those sessions need to have around creating a welcoming atmosphere. And we developed a charter. Some of the test and trial was difficult during COVID. We had to cut short our green social prescribing trial because it went into lockdown, but we did learn a lot of important lessons from that. And I think that's another thing to say is test and trial a bit and try things out, because when you're doing a new way of working, sometimes things don't work, but also you need a bit of patience and perseverance. But I think when you're trying to break down barriers for particular communities and understand those it does take innovation. It does take patience to do that. So part obviously another key part of the programme was around that diversification of use of our spaces. So as well as the green social prescribing, we really wanted to understand who the groups were, what the barriers were to those communities who are looking to engage in our parks and open spaces. We don't have big parks in Camden and Islington. We've got lots of small spaces. So most people are not that far away from a park, and yet still for lots of people, access into that park is just not possible. They just don't see it as a space for them, and they're not accessing those spaces. So a big part of our project was really starting to talk to those groups. Now, so we set target, no Black, Asian and minority ethnic communities were underrepresented in our parks. But, that's a big group of people. So you can't just say, oh, yeah, we want to engage more Black and minority ethnic communities. You need to understand those communities, what their needs are. So starting using some of the public health data, which were our key sort of communities in Camden and Islington, around which spaces, so South Asian, Black Caribbean, people with learning difficulties, and really start engaging firstly through the organisations that work with them to act as that bridge, to understand what their different needs and concerns are, and really getting into conversation with them. So we've talked about some of those barriers in some yesterday. Some people were talking about those, but communities coming in and experience racial abuse in our parks and open spaces. So they don't feel safe in those spaces, they feel vulnerable. So it's not a space that they feel comfortable in. For many communities, Muslim communities in particular, dogs are a real issue. If you're going to have a picnic in a park, and if there's dogs around and actually coming into contact with food, that's the picnic over. So some real specific challenges that those groups face. And we've been starting to have some of those conversations and build those bridges with those communities. And we've been developing targeted events, working with our partners. We've set up a seasonal event now with our early years providers, with Age UK, Islington and Whittington Health, which is not a public event. They invite their user groups along to nature-based activities in some of our parks. So some of the families our early years are working with, families that are in particular need, some of our older residents who are Age UK, who are isolated, alone and vulnerable. And we put on the activities and they bring the participants. And it has been a really successful model because they know their clients, they're phoning them to reassure them, telling them where to go, what they need to bring. And that's really brought a lot of people on. We've had really successful events. We've even put one in the winter and we had 50 people come along to a lantern making event in one of our nature reserves. None of the people that came had been to anything like that before. So it just shows that parks don't have to just be summer-based activities. Actually, you can do stuff all year round, and COVID has really helped support that. We've been doing things like dementia walks, so dementia friendly. And again, that took time to build that up. People needed to really get the confidence to come along, and took several times before they actually came. So giving staff the confidence to say, well, I should be patient, keep going, and keep persevering, keep contacting people, and people do come. And now there's regularly 25, 30 people on those dementia walks. And then last weekend we did our first Islam and Nature guided walk. We commissioned a Muslim guide to do a faith-based walk around one of our nature reserves, and that was our first public event that we've done, and it was fully booked. People came from all over London, and it was pretty much 100% people from an ethnic background. So lots of stuff going on there around that. And then marketing our parks, next slide please, is a key element, breaking down those barriers to engagement. Too often we don't market our brilliant spaces. They're there, we hope people come into them, but part of our work, we developed a strategy to identify what those key messages were, who the target groups were, and what the channels to communicate those were. And the slide, oh, sorry, next slide please. You can't see that. Here's some examples of some of the examples of the media messaging that we put out, pushing those health messages, capturing personal stories that tell of the impacts on people's lives of getting involved in parks, user-friendly maps, and social media messaging that shows representation. Because obviously the more you see people like you using something, and the more likely you are to use it yourself. I mean, it's basic and it's obvious that we weren't doing it. The project also funded a dedicated comms officer, and the impact of that has been so great that actually we've deleted a vacancy and we've built that into our future staffing model. Next slide, please. Another work stream was around developing our workforce to really make the most of what we were doing. So using the existing staff to unlock the health benefits for our communities, making sure that they've got the skills, the confidence, and capacity to do this sort of work. So we've invested that in training and community engagement, supporting volunteers, developing walking tours, because we really want staff to shift away from a sort of thinking that we're just here to maintain an asset as an operational, but actually to be much more community focused. So that means gardening teams that now actually work alongside volunteers, not just hitting a site and then legging it off as quickly as possible onto the next one. They can spend time in those spaces and work alongside volunteers. Next slide, please, and then I'll hand over to Ollie.
Thanks, Andrew. Gemma's presenting later today, I think, but just to kind of reference the work we're doing with UCL. So the strategy, as shown in slide 2, was agreed in sort of March, April time by both boroughs. And then we'll continue to kind of explore how we can learn and explain that kind of learning in a way that ourselves in the future can kind of understand the benefit of each space and how improvements can work. So we're really taking a kind of a page out of the Healthy Streets framework to understand, you know, how we can illustrate what a park is and where it can improve through what's called the Healthy Parks framework that we're doing with UCL, and UCL are kind of testing that this autumn. So the Catherine Max has been in the chat. So she helped us massively during this work and essentially wrote the strategy out for us, taking all of this kind of information out of our brains through a logic model and kind of set it out in the kind of strategy. And then our UCL friends are kind of explaining that in a kind of more visual and kind of a way we can all kind of learn from it. So I've put a link to it in the Miro board for those interested in that kind of process. And next slide, please, Owen. Just to kind of sum up then, before we go to questions, is the impacts that the kind of we've had through the project. Sorry, Aaron, move to the next slide, please. So we've got a kind of green social prescribing offer. So that's our work across into the voluntary sector. So for ourselves in Camden, we work with Voluntary Action Camden. They have a dedicated map on their website with all the activities and parks that take place, so people can kind of see them and kind of connect to them. And we've literally in the last week got the kind of first feedback of that kind of process. We've had over 100 referrals into that, and actually the predominantly of those, there are people self-referring in from finding that information and going along to those groups, and that's really to manage their own long-term health impacts, the data suggesting. Most surprisingly for me was reading that a third of those are related to long COVID. So, we're very much a kind of response to the times, as well as, the kind of health problems that we've got as a nation at the moment. We are aware of the barriers and how we can help with kind of communities getting access. That's not just the kind of conceptual barriers of people not liking dogs or don't feel safe in parks. It's also the kind of accessibility of those green spaces to where they live. Both Camden and Islington were highlighted in the Friends of Earth report about access to green spaces as being quite poor and an area of focus, and that's something we're both kind of taking forward in our next work around greening highways. How you make sure you've got kind of clear information about parks and what's actually happening there. We've all classically been using our notice boards and websites, but how do you make that welcoming and warm? So tone of voice has been a really clear thing we've taken away from this work. And then I mentioned it earlier about how we make sure people feel confident using those spaces. Because there is a sense of ownership by local communities, and if you're not careful, it can kind of get away from the authority, and people, take a little bit too much ownership, so people feel excluded. So making sure it's visible and you're there helping people to use the spaces. So in our sense, the barbecues are quite contentious in Camden, but we do support them because they bring different parts of the community into our green spaces. Obviously not this summer, but normally we would. And then very quickly, so there's some time for questions. How we invested in our health outcomes. We've changed our investment programs to include health as an outcome, so we're deliberately investing in that. One of my colleagues brought over to me, this morning, the bond distance markers that we're installing in the park today. So it's a great outcome. And then connecting in with the wider deliverers of health and social care. So we regularly now have meetings with our public health colleagues or commissioners from adults and social care. People know who we are now, and we're actively helping connect in, even between boroughs, which is great. And as Andrew mentioned, a strong focus for all park staff. It's really key now that we've all got that mental idea of why we exist. It's not to create that lovely green space. It's to make sure that our local community have somewhere to use it's outside. As you saw on slide 2, we're dense and not many people have their own private outdoor space to our parks or everyone's gardens. And I'll leave it there and hand back over to Dave for questions.
Thank you, Ollie. And Andrew, we've got a good number of questions, and we've got about 10 minutes to try and cover them best we can. So I'm going to try and sort of theme them. And first of all, I think that's standing here in my attic today. It's really inspiring to see the work that's been going on, and great to see sort of where it's got to. I'd encourage everyone to have a look at the Parks Health strategy that Ollie and Andrew have produced. So there's a number of sort of themes I'll try and pick out with you, and we'll try and keep sort of the conversation and the answers quite brief so we can get through some, if that's all right. So I'd like to talk a little bit about, I suppose, the engagement and at different levels. So starting off with sort of that local authority, I think there's sort of interest in terms of what were the key sort of ways that you influenced and got that senior buy-in across the local authorities? So are there any sort of key pieces, first of all, to get that initial, I think you mentioned that strap line about rethinking Parks for Health was a key piece, but how do you keep momentum and sort of demonstrate the impact that you were having as you were going along?
Do you want to go, Andrew?
Okay, political leadership, political buy-in, absolutely key. I mean, we were obviously, because it was a key corporate priority, early intervention and prevention, we'd set the ambition to be the best boroughs around that. So actually we were pushing an open door there. We said, well, actually we want to help tackle health inequality. What can we do? It really resonated with the politicians and senior managers. So we got that buy-in immediately for political champions. Our lead members for environment and health and well-being and Councillor Anna Wright spoke yesterday. So that is really critical that you get that political leadership, that political buy-in, because you need the bit of space to sort of work in this different way and do that. So, but because it absolutely resonated around the sort of key corporate strategic priorities, it was an open door. So I've probably got a health coach. Yeah, I remember one saying once, it's like, well, we're trying to get people to do public health the whole time, but you've come along and asked to do public health with us. So it's just it has been, we're tapping into what's important to people. How can we help other people deliver their priorities as a park service? And suddenly that's elevated our sort of profile and importance as a service. Not just a nice to have. Oh, you cut the grass, you pick the litter up. No, we're a health service now. We are meeting some of those, important needs around health inequality.
That's helpful. I think sort of two follow-ups. I'll just take the resourcing sort of one first about that. How did that link to how the work was resourced? Were there any challenges in terms of decisions around priorities that you had to take once you took that shift from, we are delivering a health service here, and how was the work being resourced across the boroughs?
And so we obviously were funded through the Future Parks Accelerator, so we had a core kind of project team, but they were predominantly delivering the kind of like project management side of it. So the actions were kind of diffused into our kind of relevant services. There were some interesting times during the lockdowns, when we were having to fence off play equipment and, patrol parks and things like that. But what we really saw was as soon as the penny dropped about the kind of importance of parks. So, everyone may remember the kind of notice on the top of Primrose Hill, stay at home, save the NHS, and then the Secretary of State, can't remember his first name, Jenrick, saying about, the importance of green spaces and how they had to stay open. Certainly the mentality of our organisations just fell in line with what we were trying to achieve. People were saying, well, what do you need? How can we help you? And, suddenly we were kind of influx with offers of help. That was great with keeping the parks kind of open. But, what we really wanted to do was the kind of activities. And as Andrew kind of said, we had to put that a little bit on hold because that unfortunately coincided with the lockdown, so we had to do that in the autumn rather than the spring when we could have got a bit more time to do the kind of learning. We did also have interest from the Department of Health right pre-COVID, and we're part of the kind of National Leadership Centre for the Green Social Prescribing work. So we had a nice Department of Health DEFRA stamp against what we were doing, and that really kind of helped sell it into our kind of directors, and our directors, really the political leadership, were absolutely behind us from day one, so that wasn't really a problem.
That's helpful, Ollie. And then a few people have flagged in the chats and question around sort of how you balanced different priorities from the community, so that sort of co-design piece, broadening who you were talking to around what the parks could bring, is really, in my opinion, it's where we need to get to, and it's a great example of that in action. But a couple of people have flagged, how have you balanced the sort of the biodiversity value of local parks for sort of urban pollinators, etc., with the sort of the drive for more access, and particularly through COVID, when there was obviously these were the sort of the prime real estate for people getting out during COVID. So just wondered how you were balancing that the sort of thriving nature element of your green space strategy with the sort of health element.
I don't think those two things are mutually exclusive at all, and I think particularly in urban areas like Islington and Camden, we're not managing triple SIs here, although I think some of the real parks maybe are. But the key is obviously more nature-based spaces are good for people's mental health and well-being. So these two things are absolutely interconnected. But if people can't enjoy and experience that wildlife, then that's where the real value in urban nature conservation for me comes from. My original first job was ecology manager at Islington, so that's my background. But it's the connection with people that I think is so vital when it comes to biodiverse spaces. And we have to see people as part of the ecology. I have to say that we're trying to create children playing in park. You need to see them as part of the ecosystem. If they want to run through the meadow, well, that's part of that's a part of their experience. We need to manage spaces so that they're resilient and robust and for nature, but we can't be excluding people from it at the same time. Or what's the point of having them?
Great, yeah, no, thanks, Andrew. And there's a few questions. We're going to have to wrap up in a minute, but people asking sort of where what type of data maybe in terms of the health outcomes that's been generated, and the social prescribing charter you mentioned. So is there somewhere people can go to sort of find that information? And just before I wrap up the final question.
So in the Miro board, I've added a link to our kind of strategy decision. So it covers like the cover paper and then the strategy itself that Catherine helped us write. We do have a formal evaluation. In fact, we have two, because we have the DEFRA one from the Green Social Prescribing midway through the project, and then we have our public health colleagues did at the end. We haven't published that, but we are very happy to kind of share it with anyone that's interested. And I see there's some asks about the Green Social Prescribing Charter as well. We happily share that with people. We just haven't got it published on the website anywhere, so we'll see how we can get that through the kind of paperwork for the conference out to people.
That's great. Thanks, Ollie. I'm sure lots of people will be really interested in some of the detail of that. That's great. So just as we sort of wrap up, I just had a very quick one, if you don't mind. So just biggest lesson and what next? A big question for a small answer, but what's the biggest lesson that you've learnt either as a council or personally through this, and what's your, what next do you think where we can go with this?
I'll take the first one because Andrew's got very exciting what's next. So the biggest lesson I think we learned is actually how, just a small kind of change in mindset and the kind of want to go and talk to people, it suddenly opens doors. The title was beneficial in itself, but going out to people and saying, we know the park's good for you, but how do you use it? What can we do to help you? Talking to the VCS about how can we get their clients who are obviously in need of the health benefits of being in green space. How can we get you into a green space? And it's suddenly kind of created a bit of a snowball. Now obviously you need to support that kind of long term through funding and kind of programs of work. But we can integrate that in our kind of activities, and then we can change our investment plans to make sure the infrastructure is there long term to kind of make that easier. But it's a constant battle. We're going to have to keep doing that over and over again. I'll stop there because Andrew can explain.
Thanks, Ollie. Yeah, where next, Andrew? Then
where next?
Exclusive.
Well, obviously there's still a huge amount to do. We've only started the journey. We sort of said this was the end of the beginning. We've got lots more to do to embed parks of health and really engage those communities, break down those barriers. There's lots of work still to do that and transform the workforce and keep that going. That's not a sort of we don't suddenly stop. But also thinking that that next stage about, Ollie mentioned it. So we want to sort of think about, well, actually, how do we take those principles into the wider public realm and create more green space? So we've been doing a lot of work around closing off roads, low traffic neighbourhoods. So creating livable neighbourhoods and creating new spaces on people's doorsteps that they can engage with, and converting road space, dead road space, and getting rid of parking bays, and so that's a whole other new chapter that is for another time probably. But that's our next ambition is to then start to increase the amount of open space and not just the people's access to what is existing.
Excellent, thank you, Andrew. And yeah, just want to say on behalf of everyone that's on the call, thank you to Andrew and Ollie, and thank you to the organisers of this 3-day event. It's been really insightful so far. I'm sure lots more to come. We started off with 201 people on the call. We've now got 276. So obviously the word got out, and even more people joined. So I hope everyone's found that useful. I know there are lots of questions we didn't get to, but I think I'm going to have to hand back to Isabel, who will now coordinate the rest of the session. Thank you.
Brilliant, thanks, Dave, and just a really big thanks to Ollie and Andrew for that. I was just sitting here scribbling and taking notes and seeing all the questions pinging in the chat. I think someone said Ollie and Andrew ace as ever, and I thought that was pretty ace in terms of the detail that's being covered.